Before we get started, I'd like to read the disclaimer on your screen. The Pharmacist Virtual Learning Experience, brought to you by Mandell's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandell's Clinical Pharmacy according to the prescription as written by the provider.
Hi, my name is Laurel, and today I'm going to demonstrate how to use the Gonal-f Pen. The Gonal-f Pen is a really cool little pen here. It's super easy to use. All you have to do is dial your dose that the clinic has told you to take, and if you go too far, you can just dial it back. You can go back and forth. It's not going to hurt the pen. So just find your dose. A typical dose is 300 units, so that's what I'm going to demonstrate today. Not sure if you can see that very well, but there's 300 units. You take your needle, pull off the tab. There's a needle on this side, which goes in to access the medication. You twist it all the way on, and then you pull off the outer two caps. You find a spot in your tummy, anywhere in your tummy, as long as it's at least an inch away from the belly button. And you don't want to inject into a spot that already has a little bruise or any soreness or redness from a previous shot. You're going to find a spot in the belly that has some fatty tissue that you can squeeze. You're going to squeeze the belly, go straight in like a dart, let go of the squeeze, and inject the medication. It will click, 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 click until it's already all instilled. In the little window, you will see 0, and you'll know that you're done. So you wait 3 seconds, have a Kleenex handy, pull out, and hold your skin. If after about 10 to 15 seconds, your skin is dry, then you're done. If you do notice some medicine leaking out, or some bleeding, which can happen. It's not something that is a problem, but you just need to hold your skin a little longer until it's dry. The pen now has a medication still left in it, so you don't want to throw that away. You want to take your large cap, slide it on there, twist it off. This part will go in the sharps container, and then the cap goes back on the pen, and you can put it back in the refrigerator for the following injection. And that's all there is to that.
Okay, Morgan, any questions come in on the Gonal-f Pen?
Yeah, the first thing is you kind of briefly mentioned it, that if you overdial, it's no biggie, you just kind of go back. But what happens if you accidentally give yourself the wrong amount of medication, like too much? So if your dose was like 150 and you actually gave yourself 200, 225, what should the patient do?
So if you do give yourself the wrong amount, the first thing you need to do is just call the clinic and let them know. That's the key. If you give yourself too little, obviously you're going to give yourself the remainder of your dose. But if you give yourself too much, you're going to need instructions on what to do next. Your clinic may tell you to just don't worry about it, continue on with your appropriate dose the following day, or they may have you reduce it a little bit. So it's going to be up to the clinic, but it will not ruin your cycle, so there's nothing to worry about with that, but just to have that good communication with your nurse or your provider so they can give you instructions on the next step.
Perfect. I think that's what you said. It's not going to ruin their cycle. The stress they probably put themselves in is worse than messing up one dose. Another question is, so usually Gonal-f is come and it's in the box and it's cold. How do you propose to travel with the medication if they're out of town or if they have to travel to their clinic or if they're home after giving a dose, how should they store it?
Okay, so Gonal-f can be stored at room temperature is considered 68 to 77 degrees. It can be stored at room temperature for up to 3 months. However, if it's kept in the refrigerator, it is good until the expiration date on the box. So my recommendation would be to keep it cool. It's going to last longer. However, if you know you're going to use it up right away, which you most likely will, it's okay to keep it at that room temperature below 77 degrees. No problem while you're traveling.
Beautiful. And then another question would be, if a patient, if they don't have enough medication left in their pen, let's say they have 75 units left and their dose is 150, what should they do?
So if you look at the pen, and you can tell by looking here at the increments how much you have left, and you notice that you don't have enough for a full dose, you have two options. You can either take this pen, which doesn't have enough left in it, put it back in the refrigerator, get a fresh pen, knowing you have enough, dial your dose, give your shot, you're done. Or you can take the pen that doesn't have enough left in it. You always want to dial a full dose in the window, give your shot, and then you're going to take a look at the window. If the window does not say 0, that means you still have more medication to give. Whatever is in the window is the remainder of the medication that you need. So you're going to take a new pen, dial your new pen to that number, put a new needle on, give yourself that second shot to complete the dose. And so there's two options there. Depends on how afraid you are of giving yourself 2 shots.
No, that's great. And I guess it kind of leads to also some of the Gonal-f pens will have overfill in them. So can you kind of touch base on, if they hear that, what that means when a pen has overfill, if their clinic says that to them, or if the pharmacy tells them their pens have overfill?
Yeah, so you never ever want to get rid of the medication, the overfill. Every Gonal-f pen has 100 units of extra medication in it, and this is considered overfill. You can use that. There's nothing wrong with it, and it's going to save you money in the long run if you take advantage of using that overfill. So my recommendation would be just dial your full dose each time, give the shot, and if it doesn't read 0, then go ahead with another pen and dial to that number, give yourself the next shot. And then you know you're using the overfill of every pen and you're getting your money's worth out of it.
Beautiful. Okay, I don't have any other questions that have come in. Anything else you want to touch base on Gonal-f the pen?
Let's see. I would say just some helpful hints about making it sting less. You can ice the site a little bit beforehand if you'd like. It doesn't typically hurt very much. It's a very small needle and it's not a very irritating medication, so I don't think you're going to have problems with this.
Hi everyone, today we're going to talk about medication administration for the injection Menipure. So Menipure is a subcutaneous injection. It is made up of FSH, follicle stimulating hormone, and LH, luteinizing hormone. And both of these hormones you make in your body. And typically at the start of a menstrual cycle, these hormones will help to recruit a dominant follicle, and then hopefully that follicle will mature, and that would be the follicle that you ovulate. But during an IVF cycle, what we want to do is try to recruit all of your resting potential antral follicles. And so we can use high doses of this medication, often paired with other injections, to help to really optimize your ovarian response. So today I'm going to show you how to administer Menipure using the Q-cap system. So the Q-cap system is great in that it's a needleless system. You can't inject with it, you can't hurt yourself with it, and it just helps you to move the liquid and the medication around to just help to make that mixing process a little bit easier. So first thing you want to do in preparation for Menopure is to make sure you have a clean workspace, wash your hands, make sure you have some alcohol pads or soap and water ready to clean the site where you're going to be injecting onto your subcutaneous tissue. So you'll need to gather your Menipure, your vial of liquid and your vial of powder. And today we're going to talk about how to mix up 1 vial of Menipure powder, and 1 vial of Menipure powder is the equivalent of 75 units. Your clinic may instruct you to take more than 1 vial of Menipure powder, and at the end we'll talk about how you can do that. So you'll get your Menipure powder and liquid ready. You're also going to need the Q-cap system, and this actually comes inside the box of Menipure. So typically it's 1 Q-cap, 2 vial of Menipure and liquid powder. And you're going to need an injection needle. Usually it's a 1/2 gauge needle, 30 gauge, 27 gauge, 25 gauge, those are all appropriate. And then you'll need a needle and syringe combination. Sometimes they'll give you just the syringe without this other needle attached. You actually won't need this today, but you'll need a 3 ml syringe to go along with it. So first things first, open up your 3 ml syringe and needle. And you can, if you have a needle attached to the end, you can actually just attach it. It's a whole screw system. So this needle tape comes off, and then you'll just have your syringe ready. And this is what's you're going to pull the Menipure back into this to eventually inject it into your body. The next thing you want to do is you want to grab your Q-cap system. You peel back the paper backing on the end, and these actually you only end up using 1 time. So you should never have to reuse a Q-cap. You should never have to reuse syringes or needles or any of that. You should have a new stock and a new supply for each day. And you want to get your vial of Menipure liquid, your mixing liquid and your Menipure powder ready. So Menipure liquid and the powder here, and the goal is to pull the liquid from the vial and put it on top of the powder so that you can pull it back into your syringe and inject it. When you try to draw from these tiny little vials, there's actually a vacuum effect. So as you're trying to draw out, the vacuum inside the little vial is trying to suck it back in. And so the best way to negate that vacuum effect is actually to first insert some air inside the vial, and that will help you to draw out your medication. So you want to get your Q-cap ready, and we've changed the packaging. Sometimes it's a little difficult to get out, but you're going to pop out that Q-cap and you're going to attach it to the end. So again, this is your Q-cap needleless system. Can't inject with it, can't hurt myself with it. It's just going to help me to move everything around. So the first thing you want to do is you want to draw back with some air and put some air into your syringe. Now, when you're mixing up Menipure, they give you 2 milliliters of mixing liquid of normal saline, but you actually only need 1 milliliter of liquid. Mixing it all together with 2 milliliters just gives you more volume than you need to inject. So you always want to make sure you pull back out only 1 milliliter per liquid when you're injecting 1 vial of Menipure powder. So if you want 1 milliliter of liquid, put 1 milliliter of air inside your syringe. Snap it on top your vial of liquid. Push the air down inside. Keep your thumb on the end of the syringe, and that helps to minimize air bubbles when you pull it back. Flip the whole thing upside down and let go. And you can see how it starts to now push back out the liquid. It's not going to ever give you exactly what you need. You'll still often need to pull back on the end of the plunger and manipulate that. And you can push back anything you don't need, including any air bubbles. By the way, don't get caught up with air bubbles. Remember, you're injecting into skin, not veins. So those little tiny air bubbles actually don't make too much of a difference. But if you have some in there, you can flick them to the top and push them back inside the vial. So once you have your 1 milliliter of mixing liquid, you're going to pull the vial of saline off the end, and you're going to grab your vial of powder. And now you're just going to repeat the process. So before you put air on top of liquid, now you're putting liquid on top of powder. So snap it on top. Push that liquid down, and that Menipure powder should dissolve almost instantly. So you can swirl it around if you need to help it, but you don't need to go crazy with shaking it. It should dissolve pretty quickly, and then you're going to flip it back upside down and pull it back out. So at this point, every drop of liquid that you put into that vial of Menipure powder is your medication. Maybe you couldn't see as well, and maybe you put a little bit less than 1 ml or a little bit more than 1 milliliter. It's all medication at this point, and you want to make sure you pull it all back out. Because most of this vial is covered by a sticker, sometimes it can be hard to see what's left inside. So I always advise my patients to pull back until you see an air bubble form at the top of your syringe. That lets you know you've pulled everything back. There's nothing left to pull. Remember, you can always push that air bubble back out through the top of your needle later. Once you have your full dose, you're actually going to unscrew this whole thing. Remember, you can't inject with that Q-cap system. You don't need it anymore. Now what you want to do is grab your subcutaneous needle for injection. So I have my short subcutaneous injection needle, and I'm just going to screw it onto the end. Pop the top off the cap off the top. And now remember, I have an air bubble on the top. So I'm just going to push it up until I see a little drop of liquid come up through the top. And now I know my needle is primed and ready to go. Subcutaneous injection sites. These injections are going to go anywhere below the belly button line. So if you think of your abdomen like a happy face, you start on one side and kind of work your way across. Remember, you're doing multiple injections a day often. And so you always want to make sure that you're using all the real estate in your abdomen. The other site markings would be on the outer portion of your thigh, that when you would sit down next to someone, if you were sitting closely, it's the outer portion where your leg might touch that other person's leg. So if we're injecting into our belly, what you want to do is you want to pinch the skin, and you want to put the needle straight in all the way down to the hub. Once the needle is all the way in, you're going to release your pinch, and you're just going to push down on the end of the plunger until there's no more liquid to inject. You pull straight out. And the next thing you want to do once you're done with your injection is to safely put the cap back on the end of your needle so that you don't stick yourself. Your clinic should hopefully, or the pharmacy will hopefully provide you with a sharps container. And so sometimes those get filled up quickly, especially if you're using multiple injections. So if you unscrew it, the needle itself goes into the sharps container, and this is actually just trash. This can go into the regular trash bin. So this would go into the sharps container, and you'd be done with your Menopure injection for that day. Now, if your clinic advises you to be using more than one vial of Menipure per day, you might be instructed to use 2 or 3 or even up to 4 vials of Menipure a day. It doesn't mean that you need to give them all in separate injections. You can actually combine multiple powders together into the same 1 milliliter of liquid. You're just further concentrating down that dose so that you're still only giving yourself 1 injection. The lead up to that process is the same. You're still going to pull out your 1 milliliter of mixing liquid, put it on top of the first vial of powder. But instead of twisting that Q cap off and putting on your needle and injecting, you're just going to pull the Q cap off the end. Now you still have it. It's still attached to the end of your syringe. And you would move on and grab a second vial of Menipure powder and repeat the process. Shoot it on top, push it down, shake it around a little bit, turn it upside down, and draw back out. Now you'd be pulling back the same volume. Remember, you didn't add any more liquid. It's still 1 milliliter of liquid, but you've added more powder to it. So this is now 2 vials of Menopure powder, or 150 units in 1 milliliter of liquid. If that's the dose you're meant to take, then again, your job is done. Twist the end of the syringe off, put your needle on, and do your injection, just like demonstrated before. If you're instructed to take 3 vials of Menopure, same concept. You just add that same volume onto the third or even a fourth if that's what your dosing instructions call for. Either way, once you're done with your mixing up your dose, if there's none left, you're now going to go ahead and discard all of your vials of Menopure powder and liquid and your Q cap and your needles and syringes, and you'll get a whole new setup for the next day. So that's your Menopure mixing and administration, and we hope that you'll do great, and we wish you luck along your journey.
Okay, awesome. First question is there a certain time of day that patients should be taking their Menipure? And also, do they need to be consistent when taking their Menipure on a day-to-day basis?
So that's a good question. So the time that you're meant to take your injections is, the answer to that question is whenever your clinic tells you to take your injections. There are some protocols that require patients to take medications twice a day, once in the morning and once at night. And there's some protocols that require patients to take their injections just once at night. Again, it's clinic specific, it's physician specific. And you might decide, that you need to follow up with your practitioner just to make sure that you know what your time of day is. But typically, what I'll tell my patients, especially if they're just administering in the evening, is to pick a time, be consistent, but you can give yourself, up to an hour on either side of that dose, of that dosing time. We know that we all have busy lives, and sometimes things get in the way, and sometimes it's impossible to be exact on the exact minute that you've given it in the past. And the other thing that comes along with this too is that it's stressful. This whole process is stressful, and if you're stressing yourself out trying to make sure you take your injection every day at 8:05 p.m., you're going to make yourself crazy. So stress can have adverse effects on all this process. So give yourself a break. Try to be as consistent as possible with at least the window that you picked. Make sure that you know whether you're meant to take your injections just once a night or twice a day, and make sure that you're consistent with that, and that sometimes it's helpful even to set an alarm for yourself, so that you can remind yourself, oh, my time's coming up, I need to get my my injections ready and all pulled up, so that you can just kind of be more zen when it's actually time to administer.
No, that's great advice. I tell my patients setting themselves a daily reminder is like in their calendar or however they did, just really does help kind of alleviate the stress and makes it where, because life does get busy and it kind of makes it easier to remember that they do have these. But also there's so much grace, and doing your medication early or late is never going to ruin anything. So really good advice. Next question, someone says they heard that Menipure can sting, maybe a little bit more than Gonal-f. Any tips or tricks to help minimize the burning sensations that can happen with Menipure?
Yeah, so that is a true fact that Menopur does feel different as you're injecting than the other injections do. The reason is that the LH compound that's in the Menopur that's not in your Gonal-f, and that can actually cause that burning effect. And so one of the things which we talked about a little bit earlier was icing the spot first. And so icing it can certainly be helpful. It can help to take the edge off. But one thing I'll usually advise patients too is, depending on the amount of subcutaneous tissue you have, like if you're a very small person and there's just not a lot of subcutaneous tissue to grab in your belly, maybe you want to give your Menopur in your thigh, and that might actually help to alleviate that burning effect. If you like giving your other injections in your belly, you can do all those in your belly and then just save the thigh for that. But one thing to note is not to panic. Now you know that sometimes that Menopur can have a different feeling than the other ones do. And so when you start to administer that injection, if you feel that burning effect, don't like freak out and pull the whole thing out. Know that it's happening, know that it's self-limiting. Once you're done injecting, that burning sensation should stop, and it shouldn't be anything that's painful. It's just like, oh, that feels a little different than the other ones do. So be aware of it. Do the little tricks that we talked about, icing, maybe switching up the injection spot, and you'll be fine.
Great tips. Next question is how to store Menipure. So someone heard that it needs to be in the fridge. Then another patient said that she's left hers out. How should patients store their Menipure before giving a dose, or why, before they start their medication?
Yeah, so Menipure is actually meant to just be kept at room temperature. So one less thing to have to worry about and clog up your refrigerator with. So you can keep it at room temperature. You can keep it out with your needles and syringes and have that one just kind of ready and nothing in advance that you need to think about to pull that out and get it ready ahead of time. It's, I have had patients over the years who just get very overwhelmed when they get their medications and they just stick all of it in the refrigerator and are just like, okay, it's all in there and it's safe. It's not necessary to keep it in the refrigerator. So they do recommend that you keep that out. And if you've done that, if you've stuck it all into the refrigerator, go ahead and just pull your Menopure out now. The only thing that really needs to be in there is Gonal-f. And if there are any other injections that we haven't touched on today, you can actually look at the stickers that come along with it or contact your nurse to see if anything else that you're using might need to be refrigerated.
Perfect. And then just like you said, if it was in the fridge, didn't ruin the medication, but yeah, it can just be left out on that counter. Another question is, someone said that their friend who's doing infertility treatment is just on Gonal-f, and she is on Gonal-f and Menipure. Is that a bad thing, or why would she be on both medications?
Yeah, so again, a lot of the decisions about your protocol and the medications that you're taking are clinic specific, and it's not necessarily right or wrong. Every time your physician comes up with a protocol, they're always taking you and your fertility history into account. The physicians look at things like AMH and egg reserve and BMI and, past success or failures with treatment cycles to help to make these decisions. And so, the old saying, there's no wrong way to skin a cat, the same is true for the fertility treatment protocols. And so your physician has likely chosen the protocol that they tend to see the best outcome with, and the one that makes the most sense for you. So it's always really important, as we always talk about, we want to make sure that you do have a fertility buddy during this process. It can be isolating to kind of go through it alone, and it's helpful to be able to find someone that understands your journey and that you can talk to and bounce ideas off of. But it is really important to be careful not to compare yourself with that person and expect that you're going to do the exact same things at the exact same time and have the same response. You're different people, and your fertility story is not the same. And so trust that your, the medications that you're on are what is right for you.
I think that is such a good point. I tell my patients all the time, not any patient's the same. And even if you unfortunately have to do multiple cycles, then your cycles aren't going to be the same. And that is okay, that we make adjustments and things. And it is definitely so great to have support systems, but to always ask your doctor or your nurse if you have questions, or talk to your healthcare provider with those, because sometimes you compare and play the comparison game, and that can sometimes go down a kind of a dark path that you don't want to go down.
Yeah.
I'd like to talk to you about applying the Synera Patch. This patch may have been prescribed to you, or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles, or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side, directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later. So pretty cool. Who would have ever thought that you can use a little patch like that? The patches actually look like Band-Aids. If you were to fall and skin your knee and you need to put a Band-Aid on it, it kind of looks like that. I took the entire backing off just to show you what it looked like in the video. But you can just peel back part of it to apply it. Now, these applications, the patches, are about $10 a piece. Insurance sometimes covers it and sometimes it doesn't. If it covers it, I'm all about using it. If it doesn't cover it, it's a little bit more of a thought process. Is the discomfort or fear that you might have about the injections, is that $10 worth, or is it not? Some people say it's a lot more than that worth, and they're going to use it no matter what. And other people will say, oh, maybe it's not so bad after all, and I don't need to move ahead and use it. So it's individual preference for you. Is something that if your healthcare provider doesn't recommend it for you, you can always ask about it. And I'm sure they'd be happy to prescribe that for you. It is by prescription only. And what I do for my patients is when I write all of their IVF prescriptions, I will put Synera Patch upon request. And you can ask your provider to do that as well. And that way, when the prescription is sent into Mandell's, the folks there can do a prior authorization for your medications and do a little test claim and see if your insurance will cover it. And then they'll reach back out to you and say yes or no, whether or not it covers it and whether or not you want it. I think it can be great, especially for people that have fear of needles anywhere. I even tell my patients that are fearful of needles, they can put it on their arm where they have their favorite vein to have blood drawn in about 20 minutes or so before their appointment to have blood drawn. And that works phenomenally well without compromising drawing your blood. And it's a whole lot easier than even thinking about having an injection of lidocaine, because after all, that's another needle and that does sting. So I think it's great for people that have a fear of needles as well. A couple of important things, since they do cost $10 a piece, a lot of patients will say, ooh, I think I'll just cut mine in half. Well, it doesn't quite work that way. It's kind of like trying to cut a Benadryl capsule in half. Once you open it up, it's kind of lost. So don't think you can save by doing that. You can't save on it by just wearing it for 15 minutes and then taking it off and closing it back up. Once it's activated after you've opened it up, it's going to be used up and can't be used again. We tell people to put it on about 20 or 30 minutes before their injection or their blood draw. It doesn't help to keep it on longer or to keep it on less. It'd be okay, I think, if you forget and it's been on there for 30 or 40 minutes as opposed to 20 or 30. You have it on for 30 or 45 minutes, it's not going to be a problem. I wouldn't just walk around with one all day. And when you take it off, you might feel a little bit of warmness, and it may make just a little redness from taking the bandage part off. It doesn't stick real hard like a super heavy duty Band-Aid or anything, but it does have a little adhesive just to keep it in place. Some patients will put it on the site, especially when you take progesterone and oil injections. That's the place that I see patients most appreciative of it. They'll put it on the site, on their hip, and then they'll just pull their britches back up and walk around and do things normally. And when it's time for the injection, 20 or 30 minutes later, then they remove it and give it. You should plan to give the injection or have the blood drawn within a half an hour of applying the patch. That's when the maximum efficiency of the medication works. So I'll stop there and see what questions Morgan has for me.
Okay, great. I think Synera patches are amazing. The best thing since sliced bread. I've actually used one of them before just to try it out, and I didn't feel I tried with a IM injection, didn't feel the injection at all. Because they are kind of pricey, so I think that's a really good point to ask your provider to at least see if they can prescribe it and then see if insurance can cover it, which sometimes it can. And also know that there's sometimes Synera, the website, they have a coupon for like your first box. That could be an option as well. Okay, it looks like a question I have. You kind of touched base on a lot of questions that came in, but one, are there any side effects from using the Synera patch that patients should be worried about?
There really aren't any side effects. Sometimes patients may have a little local reaction to the adhesive, but that's pretty uncommon, or so there may be a little bit of redness there, or just redness from the warmth of using it, but I've not seen any problems at all. People will either say that they love to use it and it makes a huge difference, or they opt not to spend the $10 a patch.
Perfect. And then for patients, one patient says she's super scared of needles, has a really bad phobia. Could she use a Synera patch and a heating pack? And if so, should she heat before the Synera or heat after?
I don't think you need to do that at all. That's a great question. But the Synera patch does the heating. I would not heat this patch up, just like I wouldn't stick it in the microwave or something like that. Don't even think about doing that. I don't know why I said it out loud. But you don't need a heating pad with this. This will do the trick. It will numb the area. If you want to use a heating pad on something later, I would wait until you regain all the feeling and the numbness is gone. So I think this will completely eliminate the need or even desire to use a heating pad. If you're not going to use the patches, maybe that's okay. But if you're using the patches, you totally don't need it.
No, I completely agree. They really do the trick. So looks like the last question I have is, if a patient says she only put her patch on, lost track of time and took it off and still maybe wasn't long enough and still have some feeling, can she put the patch back on if it's pretty immediate? And do you think that would work okay?
Nice. If after about 45 minutes, you've kind of missed the window for it being most effective, you could use another patch, but once you think of it, I would go ahead and do it. So once you take it off, you've kind of used it up and you'd have to use another one or not use one at all. Can't reuse these patches. And if you're taking 2 injections, you can't move it from one, say, oh, I'll just use it right here, and then 15 or 20 minutes or 30 minutes, I'll move it to the other place. So the maximum efficiency is a single use, a single site, and 20 to 30 minutes after you apply it.
Perfect. I think you can't say that enough. It's just they're one-time use. I've had patients try to save them and use them again, and they just aren't going to be as efficient.
Hi everyone, the following video is here to show you the mixing and administration instructions for Hcg. Hcg stands for human chorionic gonadotropin. Sometimes your pharmacy may have sent you a box that has the name on it Pregnil or Novarel, or it might say chorionic gonadotropin. Any one of those three varieties is your Hcg injection. And typically this is administered to induce an ovulation. Sometimes it's called the trigger shot by your nurse or by your clinic. When you're taking this, it's to, like I said, initiate an ovulation, and you might be preparing for a procedure to follow, such as an intrauterine insemination or an IVF egg retrieval. Your clinic will review specific mixing instructions for this medication, and they will review your dosage and the method of administration. For the video today, we will demonstrate that this medication can be given either as a subcutaneous injection or it can be given as an intramuscular. If we use intramuscular, we'll demonstrate that we use the buttock muscle for that. And with the subcutaneous, I will show you that it goes in either the lower belly or upper thigh area. Some supplies that you're going to need to get started with this medication, just to give you a little list here, is going to be your box that'll have Hcg on there, or Novarel Pregnil. You'll have 1 vial of Hcg powder or tablet. So sometimes our lingo is, some nurses will call it a powder or a tablet. Either way, that's the same. You'll have 1 vial of sterile bacteriostatic water. You'll need a 3 cc milliliter syringe, one of those. And you will need 2 22 gauge 1.5 inch needles if you're doing intramuscular injection. If you're doing subcutaneous, you will be using 1 22 gauge 1.5 inch to mix the product, and then to inject it, you will be using a smaller needle that I'll demonstrate, but is a 27 or 30 gauge 1/2 inch needle, which is the tinier, shorter needle to go just into the fatty tissue. So it's always good to get your supplies together first. Then you can always wash your hands before you're getting ready to do this. Administering an injection is not a sterile technique, but it's always good to have clean hands when you're mixing the product. So what we'll first do is, from our box, we will remove the 2 vials that we will have. One of those vials will have the powder in it. We'll simulate that with this one. There'll be a little plastic cap on the top that you remove. And the other vial will have sterile water, which you can see sort of here that we have some water in this one. And you take the cap off, the little plastic cap off that as well. Another good idea to do is that you will use a alcohol prep pad if you have it, or a cotton ball with alcohol, and you'll just wipe the tops here with alcohol. It's just a good idea whenever you're poking a needle into a surface, whether it be skin or vial, to just clean the top of that as well with your alcohol. Your syringe that you'll have, the 3 milliliter syringe, may have the 22 1.5 inch needle already attached, or then that needle might come separately. Either way, we would put that needle onto the syringe to get started. So we'll need the 3 ml 3 cc syringe with this 22 gauge 1.5 inch needle for injecting. And what we will first be doing is, I'm going to demonstrate a basic mixing method with this, but your clinic will review how much liquid to mix with, and they'll give you specifics. But even seeing my way of mixing is going to give you what you need to know in terms of the mixing. So for the demonstration, what we'll do is we'll mix with 1 ml 1 cc. So what we do is we draw down the plunger and we draw up a little air, and then we uncap the needle, and we first take our vial of sterile water, and we're going to inject a little air into that, because there's a little pressure in that vial. So it's nice to kind of equalize that little bit of that pressure in there with entering a little bit of air into it first. If you forget this step, I don't want you to worry, but I just want you to know it's something that we can do, because as I let go of that plunger, it sort of has a little mind of its own and it's moving. But then what happens is eventually that'll all stop, and I will be able to have full control over what I'm drawing up. So in this case, we're going to draw down that plunger rim to the number 1 ml, 1 cc. Once we remove that needle, this is extra fluid that you do not need to keep around, and you can put it safely into regular trash because there's been no blood contact with it, so you don't have to put it in your sharps container. Then we're going to take the sterile fluid that we've drawn up, and insert it into the powder, tablet, wafer, however you want to refer to that powdered vial, and inject all that fluid in there. At first it'll be cloudy, but then just keep that needle in there, and what you're going to do with that needle while it's in there is just roll around gently. It takes a few minutes to do this step, but just let it take, don't rush it. You just don't want to shake vigorously and create a lot of bubbles with it if you can. You want to kind of minimize all that bubbling effect. Once you see that it looks pretty clear in there, the next step is to turn the vial, or some people say invert the vial upside down. The next little cue that I always give to everybody is make sure to move that needle down as low as you can without having it fall out, because then what you're going to do is pull back on the plunger and drain every little drop that you've pushed into that vial. So 1 ml went in, 1 ml is what should come out. If you're slightly under it, is that okay? Absolutely. But if you're at a half, go back in, because that means you have the other half still left in the vial. So what went into that vial, the 1 ml, as close to that is what you want to remove from that vial, that 1 ml. Then this vial here will once again, this is also going to now be empty because we've drained everything. So this can go into regular trash. You don't have to put it into a biohazard container. And then you cap the needle that you've been working with for mixing. Here's where there'll be two differences, and I'll show the intramuscular shot first. After we have our ready mixed vial here, syringe, we're going to remove this 22 gauge 1.5 inch needle and discard, and we could open a new package with a 22 gauge 1.5 inch needle that we'll borrow from that new package. In this case, we would simply not use the syringe that came with it, but take the brand fresh new needle that's nice and sterile, because that's going to mean that's going to be good for your injection. This would be the needle that is used for a buttock muscle injection. If I were doing a subcutaneous injection on the advice of my clinic, which they will let you know, and that would be something going into the belly or the upper thigh, then you would be using a much smaller needle. So the only step that would be different is, I'm just going to take this off for a second and set it down. The only step that would be different is after mixing, I would then attach the very small needle to get ready for preparation of the injection. So we'll put that one back into that packet, and I'll come back to that. But I just wanted you to see that the mixing needle is a longer needle, so it goes in those vials, and then you may be switching to a new needle that's longer for a muscle shot, or a smaller needle that might be for that subcutaneous injection. And I'll just move everything away here. And what we're going to do is, this is an injection if we're showing and demonstrating the muscle shot first. Typically, your nurses in clinic may have drawn some circles on the upper outer quadrant of the buttocks, just to show this side here. It's just to show you that the needle's going into that red area. So we're kind of not doing a subcutaneous, which is the fatty tissue, but we're doing into that muscle, that's that glute muscle, and that's a nice big muscle for that. So a lot of times some people have asked if they can do this in the leg. It's usually preferred to give it here because this is a non-weight bearing muscle. So we sort of would avoid sometimes doing the quadricep or the deltoid of the arm, because that's a small muscle. So often you'll see that your clinic centers may be circling this area for you to administer this trigger shot. If somebody, it's recommended with this one, if somebody can, to be administering this to you. And if you were to choose to stand for the injection, what I would do is, if I was getting the injection in my right glute, I would stand with all my weight on the left side, and I could lean a little bit just so that I'm not wobbling. I could put down my right foot, and that person would have a nice relaxed muscle to administer that injection into my right glute. However, if you would like, you could lay down simply, and if I have this mannequin and she were laying down here and I was administering the injection, then by having her lay on her side and I'm administering the shot right here, the muscle's already relaxed. So either way is fine. There is no right or wrong way of standing or lying down. It's just whatever works for you, and that's what we would always want you to do, is whatever works for you. Some people ask if they can put a little ice to the area. For this injection, a lot of the clinics might say it's okay to put a little ice to numb the surface because you are going a little deeper and that will not interfere with absorption. Or your clinic may be working with you and may have ordered you some Synera patches, which is a type of numbing patch that you would apply about 20 to 30 minutes before this injection and then remove it to then administer the injection. So if you don't have the patch, it's certainly okay to sometimes, with your clinic's okay, use a little ice just to numb it. If you didn't ice, what I will say is that a lot of times by now you've had several blood draws from your arm. The pinch that you could feel a little bit here is just like a blood draw, even a lot less, because it's not going into a vein, it's just going into your muscle. So I want to give you confidence to know that not to worry about the needle going in, because you've experienced that already with those blood draws. With this, after you do the icing, or if you use a patch, what you're going to do is clean the area with a little alcohol, and then you're not going to pinch the skin. We need to leave it just as is because we want to get that needle right into the muscle. So the angle that you might see me holding this might look like a slight 45-degree angle to you, and your other hand could be here, wherever you position it that's comfortable for the person giving it. But a slight little angle, so I'm not pointing the needle down toward the floor, and I'm not parallel to the floor. It's a nice little angle so that it's going into the muscle. We don't need to jab with this. If you do see that you have a little bubble in here, or a little air bubble, is that something you want to address? You can give a little flick to the syringe. It usually rises that bubble up to the top. But if it's a real tiny one, I don't want you to worry either, because you're not using this into a vein, and that's when we really want to look for air bubbles. For a muscle shot, it's okay if you had a very small bubble there that just can't be moved, and I can even have that happen to me as well. So it's okay to flick at that to release it, but if it doesn't release, it's certainly okay to proceed with your injection. When you're doing this, like I said, it's a nice gentle angle in and a nice insertion. We do not need to jab. So you place the needle to the skin and then give a little gentle push. If you've iced or used Synera, you might not feel anything at that point. If you didn't ice or Synera, you might feel just a slight pinch to that skin, sort of like a blood draw when that needle goes in. The next step is to hold this needle in place and pull back lightly, gently, not a lot, not very far, on the plunger. Why we're doing that is we're just checking to see if any blood enters the syringe. If you've had these areas drawn, it's very unlikely that you will enter a little vessel or a little vein. That's the reason for this check. So I want to reassure you that it's not very common to happen, but when you pull back, if you were to see blood enter here, clinics might do different things, so you follow their instruction, but what we would do is either remove the needle completely if we see a little blood enter, put a little Band-Aid here, change the needle, and go to the other side to reattempt. Or the other way you could handle it is if you see a little blood, you could pull the needle away from the skin, approximately a ½ inch, check again, and if no further bleeding enters, then you could just inject. Either way is how you'll be instructed with your nurse's help in your clinic, but that's just addressing that if you do see blood, you don't want to insert the medication. You want to hold off and reposition, or remove it and go to the other side and reattempt. Either way, eventually you will get to the point where you're not going to see any blood, and you probably won't even see it the first time, and then you'll just inject nicely that fluid, let it all go in. Can do a little count of 1, 2, 3. Remove the angle, remove the needle at the same angle as going in, set it down, and then you just put a little cotton ball there. A little bit of blood will come out, a little bit of the fluid, not a lot. It'll only take 10 seconds of holding this here, not even. And then you might have it where it will stop and it'll have a little pinprick there. And you can apply a Band-Aid if you need to. Just remember you have that there. Don't forget, because it's in the back of your body. Just because Band-Aids, even if you don't have an allergy, sometimes can get a little, you might get a little irritated from that. So you just want to be able to know you don't have to leave a Band-Aid on for 24 hours or anything like that. Just for the quick 10 or 15 minutes, and then you can remove it. If this injection is being instructed by your clinic to take it as a subcutaneous injection, then what you want to know with that is the areas typically that they will reference for you is going to be in the lower abdomen and the top upper or side outer thigh area, because it wants to be in any area where you can pinch a little fat. So using my arm for that, I'm pinching a little bit of fatty tissue off of the muscle. And when you do that pinching, just do a little gentle lift. You don't have to squeeze too hard so that you're not traumatizing your skin by squeezing so hard. You could, with that little shot, subcutaneous injection, you could administer that to yourself, or you could have someone administer that to you. So that's an option. The intramuscular, it's usually recommended if you have someone that can give you that shot, it would be preferred. But with this injection, if you felt comfortable, you could self-administer, or you could have somebody give you the injection. If somebody were to have someone else give them this injection, I usually sometimes recommend that the patient could lay down and you would administer it into her belly this way, because it's a 90-degree angle, or you could administer it into the top thigh this way. Or if we're doing the side thigh, then the 90-degree angle to the side thigh is administering it like this. So it's a 90-degree angle, and if you're getting the shot given to you, then you could lay down. If you are administering the shot to yourself, then you would be in a position of where you could stand or sit, and you would be giving this straight into your belly, straight into the top thigh, and bring it into the side thigh to the side area, like we showed earlier, a little bit of that side thigh. So again, the angle for this one is a straight in, but it's a smaller needle just going 1/2 inch into the fatty tissue. So if we demonstrate that one, if somebody were self-injecting, question might get asked, can I put a little ice here? You could, but it's sometimes is recommended if you're going to do anything here, maybe to use one of the numbing patches if you have that option, that's ordered for you. But even if you don't have the numbing patch ordered, recommendation is you don't really have to ice these. It's such a tiny needle, you may not even barely feel it. At most, it might feel like a mosquito bite. We all know how that feels. It's a very quick, fleeting pinch. The reason sometimes we recommend refraining from icing with the smaller shots is that you don't want to constrict blood flow. Blood flow needs to be open in the little capillaries to help that medicine be delivered to where it needs to go. So the idea here is just we don't want to interfere with that. The numbing patch won't interfere with that, but the ice, if you leave it on too long, could. So it's best to just know that you really don't need the the ice for this. And oftentimes patients, when I do demonstrate this, they will let me know afterwards that it really wasn't as bad, and I was right, that it felt like a pinch or nothing at all. So I want to reassure you all of the same thing, that it really is something that you won't notice very much when the needle goes in, because it's so fine, that needle. This time we do need to give a little pinch to the fatty tissue. So what you want to know with that is you're giving a gentle little squeeze to the skin, like I said, not a harsh squeeze. You uncap your needle, and then when you have that little pinch of fat, you place the needle right to the skin and just give a gentle little push. Once it's all the way in, you can then push the medication in, nice and gentle. Count 1, 2, 3. Remove the needle, same angle as going in, let it out, and then put a little pressure there. Here, if you'd like to Band-Aid, you usually don't though. If anything, you might see a little clear fluid come out of this opening. So that's the medicine, so we want to make sure we put a little pressure and keep it there, keep it inside the body, but usually not needing to have to do anything with any sort of Band-Aids or anything like that. And then with all of your medications, after you are done with them, when you have this dirty needle and syringe, it goes into that Sharps container. So there is no leftover with trigger HCG. Everything you typically mix is going to then be utilized for that evening, that day, or that evening, or that morning, whatever time you're taking this. Your clinic will give you specifics with when you're taking it, how much water you're mixing with. Today's demo was to just show you the demo of mixing, and we use 1 ml, 1 cc, but you might use more, you might use less, or you will absolutely be instructed whether you're taking it as a belly shot or thigh shot, little tiny injection, or whether it will be in the muscle. So I do hope this video has helped you. If you've gotten to this point, I know you have good things ahead, and we congratulate you on getting to this point of a trigger shot, and best of luck to you with the rest of your cycle. And we'll see you back here for some future videos. So hopefully that was helpful. I think the trigger shot tends to be a very big shot in most of our clinics, and patients have heard a lot about it. So they certainly get concerns or worries, lots of questions around this. So there's a lot of patient education going on in most clinics like Tony's and mine, where we're always doing all that we can to make sure that patients are properly instructed for them on their dosage, their method of administration with this medication. So this one gets a lot of attention, and I'm sure Tony would agree with me. And I don't know if there's further questions that anyone has out there about it.
Oh yes, this is the big one for sure. I actually liked in the video that you commented after the IM injection, which typically we do ours IM in our clinic for IVF. A lot of our intrauterine inseminations are sub-Q. So we do teach it both ways depending on the cycle type. But the fluid coming out at the end, sometimes with the IM, tends to make people nervous that they did something wrong. So it is okay, you know, just to wipe that little bit off, and you still did get majority of the dose. So we try to, you know, set their mind at ease for that.
Exactly.
Just a few questions so far. How do I know exactly what time to take my trigger shot?
This is something that, as I said, there's a lot of teaching that goes on with this. I know at most clinics like our own. When you are doing this for a cycle that might be for intrauterine insemination, oftentimes you may be given a range of time that you can take it. Just for example, you might be told anywhere between 7 in the evening to 9 in the evening. So you may be given a range depending upon the procedure. With IVF, usually you're given a very specific time, because oftentimes most clinics are doing one retrieval at one time, meaning each person has their own scheduled time for a retrieval, and how you have that scheduled time is based on your trigger shot time. So just know that, you know, that is an important key factor with IVF cycles, is that this is the one medication, and pretty much the only medication I would say that's in our clinic, at least, and most often everybody else as well, that is a timed injection. And that means that the time that's given is very important to follow that, because of the setting up of the operating room and the schedule with what you're doing when you're under anesthesia for a retrieval. At least that's where we're at with our clinic in terms of doing that.
Yes, absolutely. This is another good question. Can I mix my trigger shot ahead of time, and do I have to be at home to administer it?
I have had some people probably be at restaurants out doing the same thing, right? You should know, hopefully by the day's end at a clinic, what time you're taking your injection. So usually most of us might have a 9 to 5 day or an 8:30 to 4:30 day. So you might be hearing from the clinic for sure by the end of that time frame during the day. So you'll be able to prepare for that evening. And if you do have plans being somewhere, I guess if you're somewhere that you can at least get the injection, then sometimes we do tell patients, if you're traveling to a different location and you're going to be available to do the shot at that location, main thing is bring the medication with you. What was the other question? I think it was time. What, I forget now. We said if we're a different location, or I can't remember the first part of that.
Oh, do I have to be at home, and can I mix it ahead of time?
Yeah. In terms of like mixing ahead of time, again, being that it's powder water, it's activated upon mixing. So usually most clinics will recommend mixing it no sooner than 20 minutes or so, give or take 15 minutes, and then be prepared to do that. I know for us, even, there are times when patients have a very late injection. It might even be when they're normally in bed. And you know what we always tell patients, take your phone, set a timer. If your time of your shot is midnight, then make sure to set your timer at about 11:30 so you can gather your supplies and start your mixing at about 11:45. Because I know for me, I'm up at 4:30 a.m. So that would be a very late evening to be up that late. So, you know, we often will remind you, because it's not unusual that somebody could be tired and they may fall asleep early, and we want them to know to be able to do little tricks of the trade, if you will, and making sure you get that shot at the time you're told to take it.
Yes, absolutely. The timers become your best friend when you're doing your IVF meds. You definitely don't want to miss the trigger shot time. And then if you do, all you can do is just let your clinic know, and they'll direct you from there as to if it's something that can be moved, or, you know, they'll go through the next steps from there.
Exactly.
Another question we have, which is a good one, we get this kind of stuff a lot too. I was prescribed Pregnel, but my friend was prescribed Avidril. Is there a difference between them?
Most often with regards to the trigger or the HCGs or the Avidrils, first off, to be quite frank, one of the things we want to always work with is which products might be considered in your insurance formulary, meaning that there are certain products that you might have coverage for and other products that may not be covered for you, and you'd pay more out of pocket. We're never going to compromise your cycle in that choice. But to be honest with you, when it comes to the HCGs and the triggers and the different names, there are times that you could use interchangeably, one or the other. Ovidrel is a little different than the HCGs that you saw that I mixed, because Ovidrel, it's a subcutaneous, but it's a pre-filled syringe ready to inject. So sometimes there just might be dosage variations, but if you're covered for one, like the Ovidrel, there's a way for us to make sure that you get the full dosage. And there are some clinics that might be having their patients use one or two of those pre-filled injections to give them the full benefit of the drug, even though it's a different named product and the way it looks. And then the HCGs might have a 1 bottle, 1 box that is a higher dose that equals 2 of the Ovidrel. So there's a lot of little different variations out there, guys. I wouldn't get so hung up on that. I would want you to know that every clinic is going to always do what they can to try to make sure that you're getting what is hopefully the best product for you in terms of response with dosage, not so much the drug's name and presentation, and really their coverage. Working with those insurance coverage is very much key to all of us.
Now I'm going to show you how to do a progesterone and oil intramuscular injection. First, I recommend collecting all the supplies that you need to do the injection. So first and foremost, of course, you need your progesterone and oil medication. So collect that vial. Next, you will need a syringe and needle. Typically, it's a 3 ml syringe that's used. A lot of times they will come with needles attached onto them. For the sake of this video, my practice uses the 22 gauge needle to inject and an 18 gauge needle to mix. I recommend talking to your provider about what they prefer you do for your treatment. So here I have the 3 ml syringe with a 22 gauge 1.5 inch needle. So then I also have a 1 inch 18 gauge needle to mix. You will also need your alcohol prep pad. So at this point, go ahead and take the cap off of your progesterone and oil. It just snaps off here. You'll see the rubber stopper on top. Then open up your syringe that has the needle attached. It'll peel open like a banana peel. And then you can open up your needle that you'll use to mix. Now, if your provider wants you to use the same needle to mix and administer, you won't need to do this step. So that second needle opens up like a banana peel as well. I recommend avoiding touching the top of this cap here and keeping that sterile. Then if you twist, your other needle will come off. You can set that down to use later. Then this needle will twist on. If you twist to the right, then you can remove the cap. And again, at my practice, we typically have doses of 1 ml. So for the sake of the video, that's what I'm going to use, but I would confirm this with your healthcare provider. So I recommend drawing back to the number that you will use to administer. And what I mean by that is if I'm using 1 ml, I'm drawing back right now 1 ml of air. So you can see my plunger is right at that 1 ml mark. Then you will take your vial and the needle goes right into that rubber stopper. Then push your air in, flip the vial over, pull your needle down slightly to be sure it's in the liquid and pull back, and you'll see the medication pull back into your syringe. And it is oil, so it's a little thicker, so it might take a little bit of help of you pulling down on the syringe. Now, if you have some air, that's okay. You can push back up and start over. That's perfectly fine. So like I said, I'm using 1 ml for this video, so I have 1 ml of the oil here. Take this out. So now I'm ready to administer. I do not recommend administering an intramuscular injection with an 18 gauge needle, which is why I saved my 22 gauge needle here. So this will twist off, put it directly into your sharp spin. No need to recap it. And you'll twist on your needle to inject. So now we are ready. It's time to prep our injection site. For the sake of the video, this is going to be my skin and my muscle. When you're doing it at home, I would confirm with your healthcare provider if they have a preference of a site for intramuscular injections. I typically recommend using the upper outer quadrant of the buttocks, so it's almost like your hip area to do the injection. So once you have chosen your injection site, open your alcohol prep pad, clean the site with alcohol, let it dry completely. Take the cap off of your syringe, and then you're actually going to kind of pull the skin taut, and then you will inject quickly, fast like a dart at 90 degrees. Fast there, all the way to the hub, and then press the oil in. Now it is thick, so it can take a moment to go in. Typically in skin, it's a little quicker than my cube here. Once the injection is in, you take your needle out. There might be a little bit of oil that comes out of the site, and that's okay. You can just wipe it up with some sterile gauze, and then you can recap your needle, put it into your sharps container. You're done. Now, one thing I like to mention with the progesterone oil, especially because a lot of times when patients are taking this, it's for extended periods of time, weeks on end. So the oil can actually kind of collect if you're not active and moving after you do the injection. So the worst thing you can do is go back to bed, wake up in the morning, do the injection, go back to bed and let it sit. I recommend massaging the area. You can take like a tennis ball or a lacrosse ball and kind of knead it on the area as well. Heat can help disperse the oil as well. Just if you use a heating pad, be very, very careful that you pay attention, only use it for small amounts of time. And then being active, so walking around, going for a walk, things like that can help to disperse the oil into the muscle as well.
Okay, so like I said, you know, this is similar to the Hcg injection in that it's an intramuscular injection. So the actual injection itself is very similar, but this is it's mixed in the oil, so that's a little bit different. It's a little bit thicker, and then most patients are on it for an extended amount of time, whereas your Hcg is usually a one-time deal for your trigger shot. So same type of injection, just different purposes, different medications, and a little bit different in the thickness of the liquid itself. Okay. With that, I am ready for questions if we have any quite yet.
Yes, we do have a question coming in. This is a pretty good one. Everyone's a little nervous of the progesterone injections. I feel like people come in at their new patient consult asking about these because they've already read about them. So is there anything I can do to make the injection hurt less? Can I use EMLA cream?
Yeah, absolutely. You can certainly use EMLA cream. So those that don't know what that is, it's like a topical numbing cream that you can put on the site before you do the injection. Another option is there's Synera Patches is the brand. So it's a numbing patch that you can apply directly to the site 20 to 30 minutes before the injection. Same idea, it numbs that area. We actually have videos on Sonara on the pharmacist page as well. So if you're interested in seeing that and how it differs from just a topical cream, you can definitely check that out on the pre-recorded page. That, and then, you know, aside from just the actual injection, you know, itself, same thing, you know, in fast 90 degrees like a dart, the quicker the better. Also rotating sides if you're doing it daily or however often you're doing it. So not doing it in the same exact spot every single day. Rotate sides of the hips, that can help as well.
Yeah, I like how you said in your video, like massaging with the tennis ball and just like massaging after and moving, because that's one of the biggest complaints that we get is like little knots that form under the skin, and then they get kind of tender, and then sometimes they think that might be they're allergic to the medication. So that kind of brings to the next question, like what is what is an allergic reaction with progesterone and oil?
Yeah, so, you know, like you were saying, Tony, it's normal to get these, you know, small kind of, they almost feel like little like hard balls under the skin where it kind of collects there. And am I allergic? Am I not? Is this just a small reaction? So, you know, certainly if you're getting like hive type reaction, so a rash and it's spreading, if you have any trouble breathing, swallowing, that's a medical emergency. Okay. So you need to seek help from your clinic or an emergency room, you know, if they're not open. So first and foremost, if you have any trouble breathing or swallowing, that's first and foremost, number one, get medical attention right away. Now, there can be localized irritation with the progesterone and oil, so a little bit different. Very normal to get almost like a small little redness rash in the area, especially after some time has passed of being on them. So usually that's not something that I get complaints of early on. It's usually towards the back end after that skin has become a little more irritated from you know, the frequency of the injections. So I would say that's considered normal. You can we're okay with using like an over-the-counter hydrocortisone or something like that to help, but definitely confirm that with your clinic that they're okay with something like that, just to help ease with that, because it can cause some itching as well. All those are unfortunately normal with this injection. I have some patients that try the progesterone and oil mixed with ethyl oleate. It's just a different kind of oil suspension. I get mixed reviews on that, if that truly helps with the irritation, or if it's just the fact that, you know, you're on these injections for a long time. So over time, you know, you become more sensitive with it. But definitely a localized kind of rash or redness is considered normal with these.
And sometimes, just to add on that, it might be a good idea to check in with your provider's office, because I've had patients come in and they're like, I have this rash, it's all red. And I'm like, well, you know, you're coming in, let's take a look at it. And they're actually not injecting in the right spot. They're so far over. So it's really important to get in that upper outer quadrant of the butt muscles. Because the closer in you get, it's not really muscle. So you're getting, you know, right into the tissue, which causes a lot of irritation.
Definitely. Good tip.
This is a good question. What does progesterone and oil actually do for my cycle?
Yes, so this one we are actually replacing what our bodies would do in a natural cycle. So typically in a spontaneous pregnancy, after the egg has ovulated from the follicle, fertilized and planted, and there's a pregnancy there, left over is that collapsing follicle, and it's called a corpus luteum, and that actually produces progesterone to support the pregnancy. So in medicated embryo transfer cycles, we most times don't have that corpus luteum to produce that progesterone. So we have to mimic it and replace it until the placenta takes over later on in the first trimester of pregnancy. So that's the importance, and I refer to this stuff as liquid gold. You absolutely need that progesterone supplementation to sustain pregnancy. So it's super important to, you know, as much as this causes that tenderness. And like Tony mentioned earlier, everyone knows about these, you know, prior to even starting a cycle, and there's a reason for that, but they're just so important. So, you know, utilizing that massage, the numbing and so forth is crucial, because these injections truly do carry on that pregnancy until the placenta can take over.
And then there's a question about, I guess, if referring to the EMLA cream, if you would use an alcohol wipe prior to putting the cream on.
I don't think it's necessary. I think you can go ahead and apply the cream, and then right before injection, still do your alcohol pad as normal. At that point, the cream should have already soaked in to the skin and is kind of already doing its job. So the alcohol pad shouldn't have any ill effect on that. Do you agree, Tony, in your experience?
Yeah, I would say probably before or after. I think, you know, I would definitely wipe at some point before you inject. And then a big thing you said earlier about rotating the sides, that will help a lot with pain management during these. And then I always tell patients, if like one side, I personally did these shots, so I know the pain everybody's going through with these. one side sometimes just gets worse than the other, and just maybe give that side a break for a while and then just continue to inject. We get that question a lot, if you have to rotate sides. So I would say, no, you do not have to. Would you agree with that, Kaitlyn?
Yeah, absolutely. You know, listen to your body, right? It's like, don't fix it, or don't fix it if it's not broken. Yeah.
And you can also try your thigh. I don't personally recommend it, but I know that, you know, sometimes people have success in doing like their upper outer thigh. So if that's something, you know, your clinic can show you exactly where to inject that. I don't see anything else. Do you have anything else to add on progesterone?
I don't think so. I agree with you there, though. You know, the thigh is definitely an option. It's not my first option. I think it's probably going to be a little more painful and tender than, you know, the glute muscles. But ultimately, you know, it may not be a bad idea to give it a try if you're really having, you know, severe discomfort. So I agree.
Right. Well, I guess that's all the questions we have. So I'd say we're going to wrap up. I just want to thank you again, Kaitlyn, for your time tonight. The purpose of our program, of course, is to ask questions here in a comfortable space. Thanks to all our listeners on Zoom and Facebook and sharing your excellent questions. We hope that you were able to learn something. Even if you didn't learn something, we hope we answered something for you. And then also don't forget that these virtual learning experience videos, as well as the demo videos, are on our YouTube and Facebook page and at the My Mandell's Pharmacy page. We believe that repetition leads to retention. So it will help you just to watch these over and over. And we look forward to seeing you guys here again next Monday at 7 p.m. Eastern. And then please share this program with anyone you feel that can benefit from it. A friend, a colleague, a family member. It's a great opportunity for them to get comfortable with these injections. So thank you guys. Thank you, Kaitlyn, and have a good evening.
Bye, everyone. Thank you.